very warm welcome to our viewers. I am Juline Smit. I'm a specialist physician at Pohamba Hospital, and I have here with me a wonderful professional panel and also a patient advocate. And our topic for this discussion is about autoimmune disease. You might be wondering, what is autoimmune disease? What we do know, it is a challenge of our time and it's on the rise. It affects predominantly women of childbearing age, and last year in 2023 there's been a big study in the UK where they looked at 22 million patients and found that 1 in 10 people are affected. So I'm going to move over and just quickly introduce you to my panel. I have Sister Otilia on my left, one of our nurses at Pohamba Hospital. Then I have Suzan Smit, a dietitian, also working at Pohamba. On my right, I have Winnie, and Winnie is one of our lupus patient advocates. And then last but not the least, I have Harriet Knott, a psychologist who also works closely with me. So I think to start and maybe just give a bit of information and a bit of background about autoimmune illness. Sister Otilia, we see a lot of these patients in hospital. Can you give us some information or how, what symptoms they might present with, or what is it that makes someone think they might have an autoimmune disease? Maybe just share some of your common experiences or insights in caring for patients with autoimmune illness.
Okay, thank you so much, Dr. Smith. Like she said, I'm the nurse at Lady Pohamba Private Hospital. Firstly, I would like to share, just for the viewers to understand, the meaning of autoimmune disease. So autoimmune disease, these are diseases which occurs when our immune system, which is supposed to protect us from diseases and infections, get a bit confused and they start attacking our own cells. There are a lot of autoimmune diseases, some of them which is lupus. Look at arthritis, rheumatoid arthritis. There's also Crohn's diseases. And most patients, when they come, they present with tiredness, joint pains. We also call it a butterfly rash, which normally occurs around the nose and it spreads to both cheeks. And for you to get diagnosed really with autoimmune disease, it's a long journey. It's quite taxing for especially for our specialists. So what I would like to tell people out there, for doctor to arrive to call you that you have an autoimmune disease like the ones I mentioned, you need to make sure that at least you go for medical checkups like any other person, and you need to follow up with your GPs so that at least, and also make sure that you keep a record of your symptoms. If you know that it will take time for you to go see your doctor, make sure that you keep a record of the symptoms and also take photos. We are also like these days that we do have these smartphones, because sometimes when you do go visit your doctor, the symptoms have disappeared, but at least you have something. And also, examination, intense physical examination, and also make sure that if you really feel you do have autoimmune disease, just ask your GP to refer you to the specialist, because specialists are the ones who are able really to manage autoimmune disease and do further investigations to reach to a certain diagnosis.
Okay, so Otilia, so if I listen to you, autoimmune disease, it's sometimes called the great mimic because it can cause pain, it can cause fatigue, rashes, joint swelling. And we also know the disease, at times it's quite quiet, and at times we see what medical professionals call flares. Do you want to say maybe something about flares that patients might go through with autoimmune illness?
Okay, thank you, Dr. Smith. When we talk about flares, I mean, it's a medical term which we normally use, but for a layperson, when we say the disease is flaring, that's when the symptoms are getting out of control. You know, they are worsening. So for us, if we look at autoimmune disease, we really want our patients to go for follow-up to make sure that the medications the doctor prescribed for them is taken the way it's supposed to be. And also there are certain ways, because the whole idea for us is for them to live like any other normal person. We want them to be as productive as possible. We don't want to see them in the hospital unnecessarily, because we want them to go to work, to be able to work for their families, to be like anybody else. So normally what we encourage, like I said, the importance of follow-up, importance of taking medication the way it's prescribed, because also if you look at this autoimmune disease, they also have like mind diseases. They play with your mind. You also need to sort of like live positively, to have peace with the diagnosis. That's why we say the process is very long. It's quite taxing. We bring in the importance of keeping with one doctor, so that you don't need to go back and start explaining again to, with another doctor. You get used to your own specialist. And also, there are certain things which are involved. I'm sure Harriet will come in about the mental health. You need to be very strong when it comes to mentally. That's why it's very important when you visit your specialist, they will advise you to see a psychologist if the need arises. And also, I'm sure Suzan will touch on diet, and I don't know much about it, but they say it's also good, especially when you have an autoimmune disease. And like I read, I'm a nurse actually, like I said, you need to also to avoid, there are certain conditions which will make the symptoms flare up. Like, yes, which triggers the symptoms. You need to make sure that you avoid stress, you get enough sleep, and medication the way it's prescribed, the importance of follow-up, so that at least your doctors see what's happening and, refer you accordingly.
So I think what I'm hearing from you is autoimmune illness, it's a chronic disease. This is why it also impacts patients emotionally, and often there's prominent symptoms of pain and fatigue, and this can be worse at certain times. I think from a diagnostic point of view, patients or viewers might wonder how the diagnosis is made. This can be quite a lengthy process, but it usually involves us taking a good history. It might be worthwhile inquiring in your family if there's any family members with autoimmune disease. We know there's a genetic component, and if there's someone in your family, say for instance with psoriasis or thyroid disease, that is something that can be inherited and can be part of autoimmune disease. Usually to get to a diagnosis, we do blood tests, we might do x-rays or scans, and I think the GP will start that process, but often you also need input from a specialist and sometimes even a rheumatologist. And as Sister Otilia was talking about autoimmune disorders, that medical journey will hopefully get you to a more specific diagnosis of your autoimmune problem. Will it be lupus or say Crohn's or ulcerative colitis? Multiple sclerosis is also another example. And then when we have defined the illness better, then we can look at specific treatment. Yeah. So I think the other question that sometimes come up, are we just talking about autoimmune disease because we have an interest in it, or is it on the rise? And if you look at the latest research, there is a trend that autoimmune illness worldwide is increasing, and researchers and scientists and physicians and healthcare professionals are still trying to understand this trend, but it does seem to be to do with, yes, our genes, but also something in the modern environment, and especially something that we're exposed to in more urban settings, because it seems like people in rural settings do have, when they look at incidence, it seems to be lower in rural settings. So maybe something about the stress, maybe pollution, diet in cities play a role. Sister Otilia, I wonder if there was anything else from a nursing point of view. Maybe you can advise patients things, maybe when we are with patients on the wards, things that you feel are supportive, maybe some challenges to watch out for, anything you think might be helpful?
Oh, the only thing I can add is like for the advice I can give to people out there, like I realize that there are some medications which triggered symptoms. So they just need to be careful on what they take, especially the over-the-counter medications, just to seek treatment from their, like from their specialist or GP. But if they are with a specialist, just to stick to that so that at least they avoid. Because if they are taking, because many a times they struggle with pain, especially the joint pains and all those things, just for them to avoid taking those non-steroidal or anti-inflammatory drugs at least for more than 10 days without seeking help from their health providers. And also avoiding exposing them in the sun for a long period of time, especially like in Namibia, it's very hot. From 10 o'clock, it's scorching, the heat is just too much. So at least just to avoid that time from 10 to 4 o'clock, and if they can't really avoid it, just to make sure that they wear, sun protective clothing, making use of the sunscreen. They normally recommend at least SPF of 50, and also making sure that they use the sun hats, those kind of things. And also doing sports, it helps them, because I realize many patients, when you talk to them, they do certain sports, not all the sports. So they have to talk to their doctors so that they are advised accordingly. Like swimming, those, sports which really don't put a lot of strain on their joints,
Okay. I think it's very important what Sister Otilia is talking about. Patients with autoimmune illness, and especially lupus, when they in the sun can trigger rashes. So in a country like Namibia, good to take some protection. I'm going to move to our next panelist. We're very pleased to have Winnie with us, because I think I can have a group of professionals talking about the illness, but sometimes we stand a little bit outside of the experience. So Winnie, I think if you can give our viewers a little bit of insight. You've lived with lupus for a few years. Maybe just share some of your experiences that you think might be something the audience would resonate with. Maybe some of what was challenging, and maybe also some of what you've learned through the years.
Thank you, Dr. Smit. All I can say, firstly, lupus is not recommended. I will not recommend it to anyone. Anyway, my name is Winnie Katataiza. I have been living with lupus for the past 10 years in September this year. I was diagnosed in 2014. But before that, I have been sick since 2003, which means I was diagnosed 11 years later. So I was the girl in high school that had the seizures. I was the girl that had the chronic pains. I was the girl that everybody else is going up the stairs. I was coming down the stairs. So it was very stressful for my parents, for myself, because I'm a teenager who wants to be having seizures all the time. And what Sister Otilia said, it can take long to diagnose the disease. And Dr. Smit also mentioned something about it mimics other diseases. So I remember through my journey before I was diagnosed, I had TB, because I would have night sweats. I would wake up in a pool of sweat, and I lost weight. So I go to my GP, she runs the necessary test, and at some point she's like, it can either be two things. It's either TB, the symptoms that you're presenting with, or maybe you are HIV positive. So I'm like, okay. So my TB results come back first, and they are clear. So in my mind, I'm like, so what do I actually have if it's not TB? But no, I do not have HIV. And the GP told me then, I don't know what's wrong with you. I think I have a file all over Windhoek. I think I know all the doctors. I've made doctors rich in this place. And at some point, my older sister, like doctor said that it can be hereditary. My older sister, my father's firstborn, may her soul rest in peace, she was diagnosed with lupus in 2010. I was sick before her. But for her, it was faster because she had the butterfly rash. She had a rash on her cheeks, so it was faster to diagnose. So when she told me that, sis, no, I got diagnosed, I ran back to the GP. I'm like, my sister has lupus, so why don't you test for that? But the results still came back negative. So it was stressful. So, but 4 years after that, 2013, I got pregnant, fell pregnant with my beautiful daughter, and I had seizures all through my pregnancy. But yeah, 2014, I started swelling. For me, it started with swelling, my legs, later my face, my fingers. So during the day, I would be at work, my legs start swelling. At home, I go put up my legs in the air in the morning, I'm fine. But then in the morning, my face is swollen. So, but my medical aid was depleted. I have a newborn, a 1-year-old. I'm not in pain. I'm not going to the doctor. I don't have the money. But eventually my boss forced me to go get tested. I got tested. Like Dr. Smit said, a lot of tests are run. I had to do a urine test. After that, I had to do blood test. And eventually I had to do a kidney biopsy. It's painful. Like I said, lupus is not recommended to anybody. So I got diagnosed in 2014. My doctor comes in, it was Dr. Cupido at the time. He's like, ma'am, you could never hear him. He was so subtle. Ma'am, I think you have got lupus. I'm like, yes. And he's like, it's not something nice. I'm like, at least we know what's wrong with me. After 11 years, 12 years, at least now we know what's wrong with me. So then that journey started. I thought it was, yes, I know what's wrong with me, but then after that, it was not a very nice journey. First of all, your body is affected. But not only that, your finances are affected, your social life is affected, your mental health is affected. And when all these things come to play at once, it can be really bad. So for me, I survived it because of the strong support system I had and also seeking professional help. Yes, I am all for therapists. I go do my crying. I go and I do my crying and I offload. So the journey, and one thing I also wanted to talk about is it affects your relationships. You know, I have a 10-year-old, so now she's getting there. She's turning 11. She's going to be a teenager soon. So you have to balance between taking care of her without neglecting yourself, and also taking care of yourself without neglecting the relationship that you have. And so the line is very thin. Sometimes you're like, can she plays netball? I'm not well, but she needs me to be on the sidelines. But if I do that and I push myself too hard, then I'll be down for 2 weeks and I won't be able to help her even with her homework, or I might be triggering a flare because I'm exposed to the sun, it's stress at work, which means that now I'm in hospital for 2 weeks. So which is it? So it's difficult living with a disease, and it's lupus. I don't know about any other autoimmune diseases, but lupus is expensive. One of the medications that we take is immunosuppressants. They suppress your immune system. So, and I was on Cellcept, MMF. One packet, the time I was getting diagnosed, one packet was $2,500. I needed like 4 packets, and every other medication. So you have your blood test every other time to see whether everything is working fine. You have your kidney biopsies to see if your kidneys are still fine. You have, and specialists are expensive. Doctor's appointments, and it's a thing that you can't say, you know what, I'm going to postpone it. I'm not going to go to the doctor. You have to, because it will cost you your life. It can cost you your life eventually. So apart from just, and the toll it takes on your body, the pain. We wake up in the morning, your daily routine, you wake up, as for me, you wake up, you take your Nexium for the stomach lining. and your probiotics, because I struggle with my gut. And then the moment you sit down, you're like, okay, so this is how this day is going to go. Because now, the moment I just step down, I've got inflammation in my ankles and my knees. And you're like, okay, so I'm wearing sneakers to work. My boss should just not look at because I'm wearing sneakers. Or you wake up with a bloated stomach. So you're like, okay, I'm going to wear a t-shirt. You have to somehow tailor your life to what you are going through. And for me, I've mastered it. But for somebody who's just getting diagnosed, it's very difficult because your normal has shifted. You were the netball girl, now you can't even run, you can't even walk. You are this person, and now, so your normal shifts. So my advice to people that are diagnosed with chronic illnesses, any autoimmune disease, seek professional help, especially your mental health, because I've noticed if the mind goes, the body follows suit. So you seek help. You have to take care of yourself in order to take care of other people, especially if you are a mom, not even a mom, if you are a sibling, if you are anything, because your work, if your mental health goes, your body follows and everything else crumbles around you. Your work will be affected, your relationships will be affected. So, yeah. So it's been quite a journey.
Yeah.
And we're still fighting.
Winnie, and I think the good thing is that, I mean, in the time that I've known you, is you are full of life, and you are living a life, and you're working, and lupus is something that is a part of your life, but it doesn't define your life. So I think that is really, I think for our viewers, if you can get diagnosed, and I think that is often quite a bumpy ride initially, but if you're on the correct medication, again, the wonderful thing is that people can continue working and living their lives. Yes, they need to be very careful about stress, diet, and things like that. Self-care, very important. Asking for help, very important. But if we compare it with other medical illnesses or diagnoses where it shortens people's lives, we know that for most people with autoimmune illness, they can have a life with a similar length of anyone out there. So thank you for sharing your journey. I'm always learning something from you. I think just about how to approach life. It is bittersweet, but we need to take the good and the bad and just keep living. So I think you also give us as professional insight into the variety of struggles. It's often doctors can focus on the medical things and just medication, but there's more to it living with autoimmune illness. So thank you very much. I think that's very insightful. I'm going to move over to our dietitian, and I would say my right-hand woman. Often in my own approach, when I see patients with autoimmune illness, I like to believe, and I remember I had a few mentors in medical school who always say, if a patient get unwell, they're not just someone with a heart problem or a lung or a leg, they're a person. They have feelings, they have a family, they have a work, and so I like to work holistically. It's impossible for a professional to do it on their own, so we need help. Some doctors, if they hear there's a possibility of autoimmune disease, it has a similar effect to a patient finding out it could be autoimmune disease. They want to run away because it's uncertain, it's a long journey, and they don't know where to start. So I ask viewers also to have a bit of empathy with doctors and healthcare professionals because it's difficult. Why then am I willing to work with patients in this group? I think they are young people and they're in the prime of their life. And with the right diagnosis, medication, and self-care and lifestyle changes, their lives can change significantly. And so Harriet will also talk about the importance of mental health. But what I'm saying, and it's a rough estimate from my own experience working in the practice, but if people keep to a healthy diet that supports their overall well-being, yes, it will help control symptoms of autoimmune illness. Will it be fatigue or pain? But by doing that, they'll probably prevent high blood pressure and diabetes and other illnesses developing, because they're more aware of what a healthy lifestyle looks like. And they start investing in their health because they've had this wake-up call that one can't just take your health for granted early on. And so they invest in their health, and I sometimes find they're healthier than other patients I see who come with the illness when they're in their 50s or 60s. So Suzan, do you think diet is important for patients with autoimmune illness?
Yes, definitely. Food can definitely play a role. Yes, it can't cure the disease, but it can help with fighting this inflammation. And with fighting the inflammation, we can reduce some part of the symptoms at least. So we base our anti-inflammatory eating on the Mediterranean diet. It has been proven to be the best diet so far for these situations. So I'm going to discuss quickly just how it works, and then within that I'm also going to mention the good foods or the better foods to include in your diet because it helps so well. Okay, so firstly we have the omega-3. Now this is really a fantastic a type of fatty acid that we find in fish mostly. So it fights the inflammation, and of course it's not only in fish but also in our nuts, certain nuts, walnuts, flax seeds, chia seeds. So yes, we encourage that definitely. Then secondly, we have our fruit and vegetables. Now, fruit and vegetables contain antioxidants, which again fight the free radicals. Now, the free radicals are the bad guys, which is attacking our immune system. All right, and then thirdly, we have fiber. So how fiber works is the fiber provides a food for our good bacteria, which we call probiotics. So I think Winnie, I understand where you're coming from, struggling with your stomach. So the probiotics is also help us fighting this disease or diseases because it increases our immunity. Right, fiber we get from our oats porridge, our whole grains, our brown rice, our legumes like beans and lentils and chickpeas. So yes, there's quite an amount of fiber that we can choose from. Okay, so there are a few foods that can have a bad impact on our symptoms. So there's three that I want to highlight. The first one is red meat. So Winnie, yes, I heard you mention the other day about the struggles with the red meat. So yes, so red meat.
It is Namibia.
It's Namibia. So unfortunately, this is one of the things that we struggle the most and has an impact on our symptoms. And secondly, we have our refined sugars, now meaning our typical white breads, sweets, cool drinks, cake. So this is also something that that the Namibians also struggle quite a lot with. And then, of course, the alcoholic drinks. So yes, so we say now mention all these foods in terms of good and not so good. But it's not easy to implement them, especially in Namibia. We struggle quite a lot. So we try to accommodate the patient and take it from where the patient is currently with his diet, and we take it from there. So it's not a matter of we're going to throw out all your foods and all the red meat and all the sugar. We really try to take it step by step and do what we can, do what the patient can do.
I think what you also always say is make little changes that are sustainable longer term.
Yes.
And I think if we say diet, we mean by diet not just cutting down and removing. We mean something about developing healthy eating habits and looking at what we eat and also trying it out. Sometimes with symptoms, I mean, a lot of the autoimmune patients will tell you, I like a bit of sugar, but then I can feel my body tells me through inflammation I have to cut down.
Yes, definitely. So with this also I can mention that it's not only these people with these autoimmune diseases that needs to eat healthy. We all should be eating like this. So it's actually not special. It's something that we need to do actually on a daily basis. So just where do we start? So yes, in Namibia we find it quite difficult to find fish and to cut on the alcohol and the red meat. It's difficult. So here we have actually just a few ideas or few things that we usually look at. Firstly, we aim to reduce the red meat. So meaning if you had twice a day red meat, if we can do once a day red meat, we're already cutting 50%, and it's 50% better than you did before. So where we're aiming at actually to 2 times or 3 times a week red meat, we slowly cut it down because it's not so easy to cut down on these things. Then we usually hear always that we should aim for 4 to 5 fruit and vegetables a day. Now, in Namibia it's definitely not happening. So we aiming not yet. So we aiming for at least trying 1 fruit, 1 piece of vegetable a day. That will already bring you very far. All right, and then increasing the fiber. So starting with your oats porridge in the morning, changing the white bread to the brown bread at least. Start experimenting with the legumes. This is also something new for the most patients. Make a chickpea salad, cook a bit with beans, make soup with the beans. So start a bit experimenting with that. And then also reduce the sweet treats. Okay, so it's not a matter of you may not eat sweets ever again, but maybe once a week. Keep it for yourself as a nice treat, and then you enjoy it. There's nothing wrong with that, to have something sweet. We all like that, but at least we reduce, and we trying to make it less. And then also the alcohol. So this is also something that I usually say to the patient, what can you do? How do you think you can reduce it? Because you can't tell a person who had a bottle of brandy a day just to leave it all completely. So we reduce on that, and if we can manage 1 to 2 alcoholic drinks a week, that would be much better. I must also say that it all depends on the patient also, because I do have patients which react very severely on an alcoholic or a glass of wine. So it all depends on that. So in the end, I think it's important also to mention that we must individualize. It's not, every person is not the same. So individualize. There are different triggers for the flares, and people struggle with food. So we really have to be patient, and every little step that we take with food and the patient take with food, we need to embrace and encourage. So yes, it's definitely there's a place for diet.
I think that's a wonderful sort of run through a subject that can be quite complex. I think as a general guide, if you follow some of the guidelines Suzan was giving, it will also help keeping your weight not from picking up. We know that obesity is, again, one of the big problems the modern world struggle with. And just for our viewers again, we talk about inflammation. How do we know the body is having inflammation? There is pain. One of the things we see is that if weight increase, we get more pain, we get more inflammation. If we look at cellular level, it's very interesting that some of the changes we see on cellular level is very similar to someone with an autoimmune illness, and that can just be because of additional weight that people are carrying. And the diet recommendations you're giving will help us also keep our weight nice and lean. So yeah, thank you very, very much for that. I'm going to move over to Harriet. Harriet, I think everyone here today is agreeing. I think the World Health Organization had a campaign a while ago saying no health without mental health. And so I'm going to ask, do you think that is also true and important for autoimmune disease?
Absolutely. I think the impact that the mental health can have on a patient that is struggling with autoimmune disease can be very significant, and therefore it's very important that we look at the mental health aspects of it. If you can imagine, I think Winnie would be better to also talk about that, of course, but living with chronic fatigue symptoms, perhaps, you know, if concentration might not be as it is, you maybe have pain in the body, it can be very frustrating. And obviously, living with those type of traits or symptoms can have a long-term effect on one's mood. So what I often see is that my patients, when they are diagnosed with a chronic autoimmune disease or disorder, they struggle with symptoms like feeling maybe depressed or symptoms of depression. Their motivation levels might drop. They might feel very helpless or hopeless even. Other things that I also see with patients is usually the people close to them, their caretakers, really do care about them, but the patient starts reporting that they feel like a burden, or they start feeling guilty to receive this help. So there's a lot of things that can come from being treated with autoimmune disease. And so it's very, very important, in my opinion, also to seek help. The other things that I've also noticed when looking at the mental health aspect of living with autoimmune disorders is that often patients would tell me, for instance, they struggled with low motivation or they lost their appetite, and then it's almost like misunderstood or dismissed for the illness. And so that's how we miss things like depression, because depression is also maybe loss of motivation or losing your appetite. So they can be sometimes missed signals from, are we actually treating the illness now, or are we looking at maybe a possible anxiety or depression?
And it can overlap.
It can
physical and emotional symptoms overlap.
Absolutely, but to be able to say we need to give it attention if it is also coming from a place where my mental health is suffering or struggling, and also of course treat it. The other thing that I've heard from patients as well that I feel is very important that we need to bring it to the attention as well, like you mentioned, the invisible symptoms. So patients would tell me they struggle with brain fog, or their concentration's not well, or they're really, really tired. But it's very invisible, but it's very real. And so importantly, not to undermine them in their struggles with that, and to really find ways of coping around that. Isn't that so?
Very true.
Yes.
So you might not always look ill.
Yes.
But you're struggling.
Yes.
We don't look ill. Look at me.
Yes. So,
Do I look ill? No.
Yes, I think what is important from a mental health perspective is very much to reach out and to also get a team, a multidisciplinary team. We call it, like maybe having your doctor and your physiotherapist, your psychologist, your dietitian, having a team that you trust, that can guide you on this journey, someone that you can check in. I think it's very important to also be patient, like Dr. Juline Smit said, because it does take time to find the right diagnosis Very importantly as well, I think it is to reach out, also educate yourself, read up, look at different therapies that are available. Even from a psychological point of view, I want to just say, I've had patients also tell me before, oh, I've been to this psychologist and no, this is not for me. And I always say, no, you need to take in consideration, going to a psychologist is also a very personal matter. So it's not necessary that the psychologist wasn't trying their best, but it isn't a one size fits all. So you really need to give it a shot. If it didn't work out the first time, I would urge you, please go and try again. Maybe try someone else, or maybe try someone from that uses maybe a different style, but don't give up on trying to reach out and get help. I also want to just mention, with all the impact that I said that it can have on us, obviously we need to be realistic and say that it can be quite dangerous if you are not treated well, or if you don't have the correct support. However, there is also very much a picture of hope and of an inspiring message that can come from my patients as well, that go through a journey like this. And I would like to bring it back to the symbol of the butterfly. So, as you all know, it is the lupus symbol. However, I think it is also very relevant to all autoimmune disorders. So for me, the butterfly represents a picture of maybe hope, transformation. It's inspiring. There's also new beginnings and beauty that it reflects. And when I look at the situation of where we are sitting today, trying to bring ideas together, trying to bring everyone's valuable inputs together, we are trying to also convey a message to all the patients that are struggling of being inspired and really, really looking at ways of having new beginnings, and to reach out. If you have a holistic approach to your journey, a holistic approach to this situation that you are in, just maybe this heavy cocoon that might unfold you of a heavy new diagnosis of having an autoimmune disorder, just maybe you might emerge from it feeling secured, feeling looked after, and having some hope in your heart. That's what I would like to bring over today.
Thank you, Harriet. I think when we ill, something I find, and I think Sister Otilia will agree, when you're ill and when you have autoimmune illness, there's a vulnerability. We feel vulnerable. And I think the doctors will be trying to figure out the diagnosis and your medication, and might or might not be comfortable with the emotions. And I think the role of a psychologist, the nurses are so good in assisting our patients, because you're going through a period of loss. Your old life that you knew, you will leave behind. But I think the message we want to leave with the viewers is that a new life is possible. It will probably look totally different from what you've ever imagined, but you can still have a quality of life, and you'll be able to work and do most things that other people do and find joy. So I want to thank my panel, and I was thinking maybe we can conclude. I don't want to put you on the spot, but if you can have one maybe short word of encouragement, or maybe a message that you want to share with the audience, maybe something that stood out for you. This is a month of autoimmune disease. My team have been involved in raising a lot of awareness, educating patients and their families. Maybe if just from each one of you, there's just maybe a sentence or so, maybe something that stayed with you, a message for our audience, and then we can conclude. Who wants to go first?
I don't mind.
We'll start, Harriet.
I would really like to let all our viewers know that mental health is normal, it's good, and it's okay to reach out. It's good, And it's really something that I want to promote. It doesn't mean that you are not competent. It doesn't mean that you are not capable. It doesn't mean that you're not capable to do things if you are struggling with something in your life. So reach out. I really just want to normalize mental health.
I also just want to add on to what Harriet was saying about holistic approach. I am a Christian, so one of the things that keep me going is also my faith in God. We all know the Psalm 23 that says, even though I walk through the valley of the shadow of death. And sometimes lupus can feel like that valley of the shadow of death. But what I would like to say is, we don't pitch our tent in the valley. It's okay to not be okay. We will walk through it. You know, it's okay to not to be okay. But the Bible says we walk through. It doesn't say when we sit in the valley of the shadow of death. We're walking through. So there is hope. You will walk through it. You will walk through the flare. I had COVID. I had to walk through it. It was very difficult. So let us not pitch our tents in the valley, because that is not right. So there is hope. It's hard. I'm not going to lie. It's hard. But if you have a great team, like Harriet said, if you have a great team, your doctors, you're sticking to one doctor, you have your family. And what Dr. Julian also said, that we should be patient with the healthcare professionals. From my side as a patient, we should also be patient with our caregivers. I myself get confused and frustrated, and I don't understand, because every other month it's something new. So now imagine the person who's looking at this beauty and thinking, but she can't be sick. The person that you're doing life with. So we should also be patient with them and help educate them, help them understand. And sometimes, and to the caregivers, sometimes we don't need your help, because we know that maybe you can't help us, but we need your understanding. So yes, let's not pitch our tents in the valleys, and let's be patient and give each other grace.
I like that, Winnie. Maybe Sister Otilia, something from your side?
For me, I just want people to feel that, you know, those with autoimmune disease, you are not alone. We are with you. We are there for you. We understand you. Please go for follow-up. Drink your medication. Yeah, we need you. I mean, it's okay to come to the hospital, but really we want you to be there to remain productive, by the way you take care of yourself. Like, the support system is also needed, you know. You know, there are days you feel like you don't want to do anything. It's okay, but at least if you have support system, they will come in for you just to give you that support that time you don't feel okay.
Suzan?
Yeah, I think diet, when people hear diet, it's not always a good connection. But I just want to say, in this case, it's not about cutting out and removing and only eat that and don't eat that. It's about making small changes, because I think in these situations also food can be comfort. So be patient with yourself. If you change one thing in a month, that is okay. Take it from where you are, see what you can do, and that's enough. We take it from there.
I think it's very important. I was just thinking, listening to everyone, and one of the words that came up for me is courage. I think I've been part of, and I've had the privilege to meet a lot of patients and their families with lupus. And for me, I don't have a negative feeling when I think of my overall feeling. There's a sense of courage. Now, it's very interesting, the French word for heart is cœur. So it's courage, and it's something to, what is it to have courage? It is to live with an open heart. Now, it can link in with the symbolism of the butterfly freeing itself. And I think I see qualities in lupus patients and their families and friends who support them. I want to say a big thank you to them. They're a type of medicine for the patients. And in them I see love, I see courage, I see empathy, kindness. And maybe we'll conclude with this. I think a wise man once said, don't feel impressed when you see someone who has money or, sorry Winnie, has a lot of beauty, but be impressed when people are kind, when they're patient, when they have empathy, because that is qualities people had to develop. They were not born with it. So we'll conclude on that note and say to the patients with autoimmune illness, like Winnie says, it is tough, but there is hope. And you can live a good and a productive life despite of autoimmune illness. Thank you.